Itraconazole solution is used to treat fungal infections in the mouth and throat. It belongs to a class of drugs known as azole antifungals. It works by stopping the growth of fungi. This medication is usually taken once or twice daily, with or without food. The dosage is based on your medical condition and response to treatment. It is important to take this medication regularly to get the most benefit from it. Remember to take it at the same time each day. If you have any questions about the best time to take this medication, consult your doctor or pharmacist. When taking Sporanox solution, it's best to take it by mouth on an empty stomach, as directed by your doctor. This is usually done once or twice daily. Swish the solution in your mouth for a few seconds, then swallow. The dosage and duration of treatment will depend on your medical condition and how you respond to the medication. It's important to take this antifungal medication at the same times every day for the best effect. This will help you remember to take it regularly. It's important to continue taking Sporanox solution until you've finished the full prescribed amount, even if your symptoms improve before then. Stopping the medication too early may cause the infection to return. It's also important to note that the different forms of this medication, such as capsule, tablet, and solution, deliver different amounts of medication and may be used for different purposes. It's essential to follow your doctor's directions and not switch between the different forms or brands of this drug without their guidance. If your condition does not improve or gets worse while taking Sporanox solution, be sure to inform your doctor. Some common side effects of Sporanox solution may include nausea/vomiting, diarrhea, headache, stomach upset, or dizziness. These effects should be reported to your doctor or pharmacist if they persist or worsen. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, you should notify your doctor immediately if you experience any serious side effects, such as numbness/tingling of arms/legs, hearing loss, or mental/mood changes, such as depression. It's also important to watch out for symptoms of liver disease, such as nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing eyes/skin, or dark urine, as itraconazole has rarely caused very serious liver disease. Additionally, itraconazole can cause a mild rash, so it's essential to seek medical help if you develop any rash. Although a very serious allergic reaction to Sporanox solution is rare, you should seek immediate medical help if you notice any symptoms of a severe allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed above, it's important to contact your doctor or pharmacist. Please note that the information provided here may not be a complete list of possible side effects, and it's important to consult with a healthcare professional if you have any concerns. Sporanox solution may rarely cause or worsen heart failure. If you experience symptoms such as shortness of breath, swelling ankles/feet, unusual tiredness, or sudden weight gain, it is important to consult your doctor immediately. This medication can also slow down the removal of other medications from your body, which may cause serious side effects. It is important to inform your doctor and pharmacist of all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This will help them to determine any potential interactions with Sporanox solution. Before taking Sporanox solution, it's important to let your doctor or pharmacist know if you have any allergies to it or other similar medications. This product may contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist for more details. Be sure to inform your doctor or pharmacist about your medical history, especially if you have any heart, liver, kidney, or lung disease. This is important for your safety while using this medication. Sporanox solution may cause dizziness, and consuming alcohol or marijuana can increase this effect. It's recommended to avoid driving, using machinery, or anything that requires alertness until you can do so safely. It's also best to avoid alcoholic beverages and discuss marijuana use with your doctor. Alcohol use may also increase the risk of serious liver problems. If you have any upcoming surgeries, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, there may be a greater risk of hearing loss while using this medication. It's important to be aware of this potential risk. If you are pregnant, it's crucial to only use this medication when clearly needed, as it may harm an unborn baby. Discuss the risks and benefits with your doctor, and inquire about reliable forms of birth control while taking this medication and for 2 months after stopping treatment. It's also important to note that Sporanox solution can pass into breast milk, so be sure to consult your doctor before breastfeeding. When taking Sporanox solution, it's important to be aware of potential drug interactions that could affect how it works or increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Itraconazole, the active ingredient in Sporanox solution, can interact with many other medications, so it's crucial to be cautious. Certain medications can affect the removal of itraconazole from your body, which may impact how it works. Examples of these medications include efavirenz, isoniazid, nevirapine, rifamycins, such as rifabutin, and certain drugs used to treat seizures, such as phenytoin. Always discuss any concerns or questions about potential drug interactions with your doctor or pharmacist. If someone has taken too much Sporanox solution and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Remember, Sporanox solution is prescribed specifically for your current condition and should not be shared with others. Your doctor may also conduct lab or medical tests, such as liver function tests, before and during your treatment with Sporanox solution. It's important to keep all medical and lab appointments and consult your doctor for more details. This medication should not be used later to treat or prevent another infection unless directed by your doctor. If you forget to take a dose of Sporanox solution, take it as soon as you remember. However, if it's close to the time of your next dose, just skip the missed dose and take your next dose at the usual time. It's important not to take a double dose to make up for the missed one. Make sure to store Sporanox solution at room temperature and away from light. Avoid freezing it and keep it out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. If you have any questions about how to dispose of Sporanox solution, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.